Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about hangovers. Hangovers are characterized by a constellation of unpleasant mental and physical symptoms that occur after a bout of heavy drinking. Now, the symptoms, intensity and duration and severity, they're going to vary from person to person, occasion to occasion, and they're going to depend to some extent on the type of beverage that you consume. There are things other than the alcohol in the drink that you're consuming that might lead to greater severity of hangover. And we also know that they're associated with a lack of food consumption, dehydration, decreased quality of sleep the night before you stay up drinking. If you engage in physical activity while you're drinking, hangover tends to be worse. If you're in poor health, depends on your personality traits and your temperament, a family history of alcoholism, the other kind of medicines that you're taking at the time, whether you have some guilt or regret about your drinking. The word hangover comes from the Norwegian vasalgia, means uneasiness following debauchery. We've known about hangovers as long as we've known about alcohol. It seems that there's no question that if you drink enough, and if you do it over a short enough period of time, then chances are you have a good chance of getting a hangover. But we know that some people get hangovers with only 1 to 3 drinks, and other people can drink heavily and not seem to get any hangovers. But we do know that 75% of men who drink to intoxication, not 100%, but 75% of men who drink to intoxication are going to suffer from a hangover. And if you're a routine drinker, you consume 2 or more drinks per day, well, over the course of a year, you have at least a 50% chance of having at least one hangover. If you consume 5 to 7 standard cocktails over a period of 4 to 6 hours, we can pretty much assure you that you're going to have a hangover. If we look at the demographics, hangovers are more common in women than men because women are smaller, and if they consume the same amount of alcohol, they're going to have a higher blood alcohol concentration. And with a higher blood alcohol concentration, the fall is going to be greater and they're going to have more symptoms. But if we equalize and look at the same blood alcohol concentration in men and in women, which means women will consume less alcohol, well, the incidence and the severity and the susceptibility seems equal between men and women. Hangovers seem to be somewhat less common as people grow older, and that probably has to do more with the difference in their drinking patterns than with anything else. Older people tend to drink less, and they tend to drink with meals. And actually, there's some enzyme changes that occur over a lifetime that actually would put the elderly at more risk for developing hangover. Well, a hangover occurs during the decrease in the blood alcohol concentration, and the worst symptoms that occur with hangovers occur when the blood alcohol concentration falls to 0. 0. So there isn't any alcohol left if we were to analyze your blood. Well, if we correlate how much your blood alcohol level has to be in order for you to get a hangover, we say, well, it probably has to be over about 0.1%. But that's not really necessarily true. Some people are extremely susceptible to the negative effects of alcohol, and other people, well, they drink a lot, and their blood alcohol concentration can get to higher levels than we can study in the laboratory situation. Because if the blood alcohol level gets too high, then a person might be at risk for other problems. So out in the community, we find people drinking 2 and 3 times as much as we can use in the laboratory. What are the symptoms that these people have? Well, more than 50% of the people with hangovers are going to complain of fatigue and thirst and drowsiness and sleepiness. They're going to complain of headache and dry mouth and nausea and weakness, and they're going to complain of decreased alertness and problems with concentration and apathy and a decrease in their reaction time that puts them at risk if they happen to try to drive or try to fly an airplane. Somewhere less than 50% are going to complain of clumsiness and agitation and vertigo and memory problems and gastrointestinal problems and dizziness and stomach pain. They're going to have restlessness and shiver and sweat and become disoriented and have ringing in their ears. And some people with hangovers complain of anxiety or depression or misery or guilt or embarrassment. Some complain of a racing heart or sensitivity to light and sound or irritation or exhaustion. And some people can develop headaches. Now, it's uncommon to develop a headache within about 3 hours of drinking. That's relatively rare. But delayed headaches are extremely common, and they seem to peak in incidence as the blood alcohol level approaches zero. And that's when they have the severe headache associated with the nausea and the vomiting and the sensitivity to light. Now, with red wine, there's an exception. Red wine headaches occurring somewhere between 30 minutes and 3 hours after drinking are not associated with hangover. People with hangovers have an increase by about 2 to 3-fold in their likelihood of dying from cardiovascular-related disease, even if they don't have any heart-related arterial narrowing, even if they don't have any coronary artery disease. And they also are more prone to violence and aggression. And if we study them physiologically, we find there are a lot of changes that occur in the heart and in the brain. There's diffuse slowing of the electroencephalogram, and there's depression of the cortical activity in the brain, and there are some psychomotor deficits that occur. But interestingly, people, even though they have these hangovers, and even though they're very uncomfortable, that doesn't deter them from drinking again in the future overwhelmingly. And what happens is many of them resort to drinking more. That's the eye-opener to get rid of the hangover. Now, some people say, hey, I don't get hangovers. I'm resistant to hangovers. About 25% of people do. But again, that goes back to the studies that we were talking about that limited the blood alcohol concentration to 0.1. When they go out in the community and they drink like they do and they get the blood alcohol concentrations considerably higher, the likelihood that they're going to get headaches increases dramatically. And the elderly people who say, well, I don't get hangovers anymore. Well, the reason they don't get hangovers is they tend not to go on the binges like they did when they were 18 to 24 years of age. They drink less. And of course, they drink with their meals. Well, hangovers are a major problem because people believe that when the blood alcohol concentration is zero, that they're okay. So the FAA has the bottle to throttle rule. 8 hours between the time when you drink and when you can fly an airplane. But we know from military studies that pilots are impaired for in excess of 10 to 15 hours after they stop drinking. And the same with professional truck drivers, who unfortunately seem to have a relatively high incidence of driving with hangovers, at least some of them. Well, genetics has an awful lot to do with hangovers. And studies both here and in Australia have shown that genes might influence about 50% of the likelihood of your having a hangover because of the enzymes that are necessary to metabolize the alcohol. They vary depending on your genetic inheritance, and so does your impulsivity or your lack of control over drinking, and your ability even to learn from the past. Why do people develop hangovers? They develop hangovers because when you drink alcohol, alcohol makes you urinate. So if you consume alcohol, let's say 8 ounces of alcohol, you're going to pass out about 32 ounces of urine. You do that because of the altered chemical known as antidiuretic hormone or vasopressin. There's decreased release of it. So you urinate a lot, and also you lose some fluid depending on whether you're perspiring a lot or vomiting or have diarrhea. And the dehydration that comes with the alcohol, that can lead to a lot of the symptoms. So the thirst and the weakness and the dryness of the mouth and the dizziness and the lightheadedness. And then you have some of the stomach changes, the intestinal changes. You get some gastritis and delayed gastric emptying. And you have more acid production. You can develop a fatty liver because of some of the metabolic changes, and it alters the secretion of the pancreatic juices and the intestinal secretions. And that can result in upper abdominal pain and nausea and vomiting. And then people who drink tend to have a relatively lower sugar level. You exhaust the glucose stores in the liver. You tend not to eat as much. Get that fatty liver, you make more lactic acid. All that can end up with symptoms of fatigue and weakness and mood changes, and then it alters your sleep patterns. Alcohol is a sedative. Yes, indeed, it'll help increase your ability to fall asleep, but it's disruptive of your sleep. You're going to have shorter duration and poorer quality of sleep. You're going to suffer from insomnia. And that's especially important because most people drink in the evening. It's going to decrease your REM sleep, increase your slow wave sleep. It's going to relax the muscles in your throat. So you're more prone to obstructive sleep apnea, and it changes, these hangovers change your circadian rhythms. They change your body temperature. So during the time when you're intoxicated, your body temperature is relatively low, but it's high when you suffer from your hangover because of some changes in hormone secretion, in your growth hormone. It increases your cortisol, which alters your carbohydrate metabolism and changes your response to stress. And when you drink, it also is going to change the cytokines in your body. The cytokines are what causes your symptoms if you happen to have the cold or the flu or a viral infection. That leads to the nausea and the vomiting and the headache and the fatigue, and that all is part and parcel of the metabolism of alcohol. Well, it also is going to lead to some changes in the thromboxane. And thromboxane is the same sort of thing. You've heard of the prostaglandins. Well, this is the prostaglandin family. And that's why some people believe that if you take an aspirin or if you take a Motrin, it might help. And we find that if you drink alcohol, it's going to change the GABA receptors and the amount of glutamic acid or the glutamate that your body produces. And when you have the hangover, they're going to come back to normal, but they're going to overshoot the normal bounds. And when they overshoot the normal bounds, that's when anxiety kicks in and you wake up and you're jittery and you're shaky. Well, alcohol significantly alters the concentration of a variety of hormones inside your body. We've already talked about the cortisol, the aldosterone, the vasopressin, and insulin, and norepinephrine. It's going to decrease the amount of testosterone and estradiol and growth hormone and epinephrine. And if you drink and develop a hangover, that's going to increase the amount of oxidative stress. Everyone wants to take an antioxidant. Well, you do exactly the opposite when you drink. You cause an oxidation reaction. Oxidation reaction can alter the chemicals in the fat and the protein and the DNA implicated in a variety of different medical diseases, and that leads to an increase in the amount of inflammation. And that inflammation can cause some depression and some memory problems, lack of coordination. Overall, alcohol hangovers have an awful lot of similarity with withdrawal symptoms in those people who have been drinking heavily. Well, if we look at alcohol metabolism, alcohol, once you drink it, is going to be metabolized with an enzyme known as alcohol dehydrogenase, and it's going to form something called acetaldehyde. And acetaldehyde has to get out of the body. And the way the body gets rid of it is through an enzyme known as acetaldehyde dehydrogenase. But there's variation in the amount that your body has depending on your genetic inheritance. You need to get rid of the acetaldehyde, and the body changes it into acetic acid. And acetic acid is easily taken care of by the body. But it increases the amount of adenosine in the brain, and if you have more adenosine in the brain, that's going to give you a headache, and that's part of the reason why people drink coffee, because the caffeine seems to decrease the adenosine. Now, getting back to the acetaldehyde, it's 10 to 30 times more toxic than alcohol, and it remains elevated in the bloodstream for hours after you stop drinking. It's a chemically reactive substance that interferes with a variety of other proteins in the system. At an increased concentration, acetaldehyde can cause a rapid heart rate and sweating and flushing and vomiting. And it also acts as an oxidant. Remember, you want antioxidants. You don't want oxidants. So it appears that the likelihood of a hangover in some people parallels the amount of acetaldehyde, which parallels the amount of the enzyme acetaldehyde dehydrogenase. If you have too much of the acetaldehyde in the system, it's going to cause you to urinate a lot. It's going to change your renin levels and your aldosterone levels, a variety of different kinds of substances. Well, fortunately, the half-life of acetaldehyde is only about 30 minutes, so it's unlikely to be the major cause of hangovers, but it's certainly a contributory substance. We know that depending on the type of, or the polymorphism, it's called, the type of the structure of the acetaldehyde dehydrogenase, it may delay getting rid of alcohol by about 50%. And by the way, there's some acetaldehyde in tobacco, so you shouldn't smoke and drink at the same time. And then there are the congeners. Those are the other substances that are either added to or occur naturally in the alcohol. These are the things that lead to the taste and the smell and the appearance of the alcohol, and sometimes they're from the aging process or fermentation or the degradation of alcohol, or they can be added. These are a variety of chemicals known as the amides and the amines and the esters and the tannins and the histamines. One of the substances known as methanol. And we find the congeners are not equally distributed in all of the different beverages. So for instance, brandy has the most, red wine has the next tier, then we go down to rum, finally to whiskey, ultimately to white wine. And if we go to either gin or vodka or beer, they contain the least number of congeners, and they are least likely to give you a hangover. So if we look at people who consume, let's say, 7 shots of wine or whiskey, well, they're going to get a hangover. In order to have a hangover from beer, they have to consume twice as much quantity, which means twice as much alcohol, to get the same hangover that they would get with half of the amount of wine or with shots of alcohol. Why? Because of the congeners. And because of the congeners, we find that given the same amount of alcohol, maybe 3% of people consuming vodka are going to develop a hangover, while 1/3 or 33% of the people consuming vodka are going to develop a hangover. Now the methanol, one of the congeners, an important congener, just has 1 carbon fewer than alcohol, 2 hydrogens fewer. It's broken down into formic acid and formaldehyde. Formaldehyde, you know, that's the stuff that they embalm bodies with. Too much of that obviously isn't very good for you. And alcohol, if you have alcohol in the system, it's going to prevent the metabolism of the methanol. It's going to passively get out of the body. But when the alcohol level falls to 0, unfortunately, the remaining methanol is going to be metabolized into the formic acid and the formaldehyde. So a hangover isn't solely related to the amount of alcohol you consume. We know there's a substance, and it's known as ethyl glucuronide. And ethyl glucuronide, it has a tendency to peak about 3 hours after you've been drinking. If you have low-dose alcohol, it's going to be around in the bloodstream for maybe about 6 hours. A higher dose of alcohol, it's going to be around for maybe about 24 hours. And it seems that this substance sort of parallels the cognitive and psychomotor impairment that you have when alcohol is no longer present in the body. Well, how can you reduce your risk of a hangover? Well, reduce it by consuming less than 1 drink an hour. Have a glass of water for every alcoholic beverage that you consume. Don't have carbonated drink at the time, because the carbonation is going to increase the amount of absorption of alcohol, the amount the alcohol is going to be absorbed. Choose your beverages carefully. Choose them with relatively low levels of congeners. Eat before you go and drink, and even while you're drinking. Don't smoke cigarettes, and make sure you have a good night's sleep before you go out drinking. Well, what about all of those treatments you see for hangovers on the internet? Well, unfortunately, there are an enormous number of them, none of which have proven to be especially useful. And unfortunately, some of them can be harmful. So some of the remedies that are suggested are salt and pepper, or Worcestershire sauce, or drink a Coca-Cola, or have a Bloody Mary, or tomato juice and a beer. Have some pizza, have some cabbage, have an artichoke, or some eggs, or some green tea, or honey, or sit in a hot tub or a sauna, or inhale oxygen. Well, you have to realize that the symptoms are going to go away in 8 to 24 hours, almost irrespective of whatever you do. But certainly you can choose properly and avoid some wine and some brandy and some whiskey. Maybe instead, if you're going to drink, have a beer or some gin or some vodka. Make certain that you have enough sugar circulating in your system. So have some fruit juice or some food that has some sugar in it, some simple carbohydrates. That would be a good idea. You want to avoid dehydration. That's why you want to drink extra water. That's going to decrease the symptoms of thirst and headache and dry mouth. Some people believe that you should take a non-steroidal anti-inflammatory drug, a drug like naproxen or ibuprofen or Motrin. That'll alter that prostaglandin substance that we talked about a moment ago that's thought to be involved in the formation of the hangovers. But if you consume those products and you've already irritated your stomach because of the alcohol, you might develop some extra gastric irritation and some gastric bleeding. Consider an antacid to calm the stomach. And some people even take Zofran, which is an antagonist of serotonin that's used to counteract some nausea and some vomiting. Some people believe in beta blockers like propranolol. Some people think vitamin B6 is helpful. But none of those seem to work very well. The idea of consuming more alcohol, well, that's sort of adding fuel to the fire. Some people believe in vitamin B6 or derivatives of vitamin B6. They really haven't proven to be very effective. And other people believe that you can prophylactically prevent the headache by having some red ginseng or maybe having some Korean pear juice or some product known as After Effect. Well, most of the studies on these kind of chemicals have been done by people who are involved in selling them to you. We don't have really good scientific evidence that any of them are really helpful. So, what should you do? Well, what you should do is you should remember that you can significantly reduce the likelihood that you're going to suffer from a hangover. And if you choose your beverage appropriately, choose the duration of your drinking, space it out, have water or juice in between. If you do that and have a good night's sleep before, you might be able to reduce the likelihood of a hangover. But certainly, if you've been out drinking and you suffer from confusion or seizures or slow breathing or irregular breathing, your skin starts to turn blue, the temperature goes down somewhat, you have difficulty with consciousness, have somebody take you to a doctor. But remember, alcohol is okay when it's consumed appropriately. It's when people go out and overdo it that all of the problems begin. And now you know how to avoid some of those problems. So, cheers. Thanks for watching. I'm Dr. Ken Landau.